Count down for me.
Go.
Hi, I'm Wendy Griffith, and I'm a nurse practitioner student at Auburn University. And today I will be completing a head-to-toe physical examination on this 21-year-old female patient. I will begin by introducing myself to the patient, telling her the purpose of the exam and gaining her permission. Prior to this video, I did conduct a patient interview and asked questions about her health history. At that time, I assessed her speech patterns. I also assessed her general appearance, her personal hygiene. I assessed if she was dressed appropriately for the situation and the weather. And then she walked into our examination area here, and I assessed her gait during that time. I began by washing my hands, and then I do want to say, as I go through each system, I am looking at the skin as I move from head to toe, and I'm assessing the skin for color, any lesions or abnormalities, also assessing the texture of the skin. During the patient interview, after we did that, we also measured Jordan's vital signs. We checked her blood pressure in the sitting position. We checked her tympanic temperature. We assessed her respiratory rate and her heart rate. We checked her O2 saturation, and we also did a height and weight measurement on her and calculated her BMI. Now we will start with doing the head and neck, and I'll begin by doing an inspection of Jordan's head and neck, and I'm looking at just the general color. I also want to assess her hair at this time and the skin on her head. I'm looking for the pattern of hair distribution, if the hair is clean, shiny, and also the pattern of growth, looking to make sure there's an even distribution. And I also want to see if there's any signs of any infestation also. I will then palpate her head, and as I do that, I'm just feeling for any bulges or any signs of trauma as I do that. Jordan, I will ask you to take your glasses off and look at me. And now I will just begin my palpation of the face. And I'm just palpating for bony prominences, any lumps or lesions. I also want to palpate her sinuses at this time, the frontal sinuses, and I'll ask, do you have any tenderness as I do this? And another thing too you want to do is just some percussion of the sinuses, and this will check to tell if the sinuses are dull or resonant. And that will give you clues as to if there's congestion, pain. We're looking for resonant sounds as we percuss. The next thing we will assess while we're at the head and neck is the temporomandibular joint, and that is right here. And Jordan, I will ask you to open and close your mouth as I feel this, and I'm feeling, okay, open, close, for clicking, which she does have. And I'll also ask you at this time to just clench your teeth. Okay, smile, and then can you frown for me? Frown, yeah, there you go, there you go. All right, and that will be our temporomandibular joint, and also assessing the trigeminal nerve. Okay, if you will take your glasses off, I'm gonna move on to the eyes. I'll begin by just inspection of the eyes. I do want to ask you, Jordan, if you will raise your eyebrows, okay, and then lower, okay. And now just looking ahead, I'm going to just inspect and palpate the eyebrows, the upper lids, the lower lids. I'll also pull gently down and assess her conjunctiva to make sure it's pink. One thing I will say is that as I do this assessment, I'm going to just do things on one side, but for purposes of the video, but they would be done bilaterally in a real examination. I'd also like to mention too that my patient is going to remain clothed during this assessment. for the purposes of the video, but for the real examination, the patient would ideally be in a gown, unclothed underneath, and then inspection, palpation, auscultation would be done directly against the skin. Okay, I will use my ophthalmoscope now, and I'm going to do a further examination on Jordan's eyes. And I'm going to begin by just asking Jordan if you will look here at my shoulder, and I'm going to look into her eye. And as I do, I'm looking in, and I'm looking for the optic disc, and also judge, I want to look for the red reflex at this time. I'm looking at the sclera, the cornea, and looking at the colors of those. When I examine the fundus at the posterior of the eye, I'm looking for the arteries, veins, and where they cross. I want to see if there's any signs of any bleeding patterns in the posterior eye. And I want to look at the retina and the adjacent retina and the fovea. Next, I will, in the examination, will check the patient's visual acuity. Ideally, that is done with a standard size Snellen chart that looks like this. It's posted on a wall, and then the patient stands 20 feet away, and we would have her read each line of letters line by line, and we can judge her visual acuity with that. But for the purposes of this video, in our area here, we're just going to talk about that. Okay. Now, I do want to check Jordan further visual acuity with you, and I will have you can take this off, and this will check Jordan's peripheral vision. You'll cover this eye. Okay, I'm going to bring my fingers in, and you tell me when you see them and how many fingers you see.
2, 3, 4.
Okay, now cover your other eye. Okay.
2, 3, 4.
Okay, good job. And that's the static finger wiggle test. I'll use my pen light now, and I want to look at Jordan's pupils. I'm going to also do a little bit closer examination too of the sclera and the cornea, and we'll also be checking the cardinal signs of direction with my pen light. Okay, and then I want to just shine this, and ideally we would do this in a dark or dimly lit room. Okay. Now, Jordan, I want you to watch the pen light. Just hold your head straight and with your eyes. Okay, I'm coming in from all different directions. Okay, and now if you will just watch my finger, and I'm going to bring it in close. And Jordan has normal pupillary response. They're equally round and reactive to light, and her accommodation is normal as well. Okay. Now we'll move on to assessment of the ears and the hearing. For this part 2, I'm going to do the Weber, Rhine, and the whisper test. Okay, and Jordan, what I'm going to do is strike this tuning fork, and then I'm going to place the end of it on the center of your head. And I want you to tell me if you hear the vibrations equally in both your ears, okay?
Yes.
Okay. And now we will do the test, the Weber test that will check for bone conduction. Jordan, I'll strike this tuning fork, and then I'm going to hold it on the bone, the masseter bone behind your ear. You'll feel the vibrations, tell me when they stop, and then I'm going to bring the other part and hold it in front of your ear, and you tell me when that stops, okay?
Stop. Stop.
Okay, and that's a normal finding. Air conduction is longer than bone conduction. Okay. We will next look we'll inspect Jordan's outer ear, and we're looking at her auricle here. We're looking at the skin on the ear, and we're also looking to see if there's any drainage or signs of abnormalities. And I will look too into her middle and inner ear with my otoscope. And I want to pull the ear gently up and out. And as I do that, I am looking for any cerumen in the middle ear canal. I want to judge the color and how much is in there. And then I also will look at the tympanic membrane in the inner ear, and I'm looking for a pearly gray appearance to that tympanic membrane. Okay, one more thing that we want to check with your hearing, Jordan, is the whisper test. And I'm going to whisper some letters and numbers while standing behind you, and then I want you to repeat those out loud.
A, 2, 3. B4, 6.
Okay, and she got those right, so her hearing is within normal limits. Okay, I do want to do a check also on her nose, and I'll ask you to take your glasses off for me. And I want to just palpate the cartilage here and then the bone here. I want to look in the nose also and look at the nasal mucosa and look at the color. If you just hold your head back a little bit for me. And I want to look at the nasal mucosa here to make sure that it's pink and moist, which is what I'm seeing. I'm also looking at the turbinates to make sure that is normal in appearance without any cracks or lesions. Also looking at drainage. One other thing too, with the further examination of the head and neck, we want to go back to the mouth, and I'm going to look inside of Jordan's mouth again, and I'll look at her lips and just assess if they're pink and moist, if there's any dryness, cracks. Also look at the corners of her mouth. Jordan, I'll ask you to open your mouth for me. There you go. Say ah. Okay. I'm looking at just a general condition of the teeth. You can stick out your tongue for me. And the appearance of the tongue. I want to look in the papilla of that. And also want to look at the soft palate. And Jordan, just hold your mouth. Okay, open up real wide. Open wide. And just say ah, ah. And also at this time I would also check the gag reflex, but we'll spare her from that for the purpose of this examination. Okay. Also, while standing behind the patient, we are going to also palpate her neck. And Jordan, I'm going to give you this bottle of water. And while you swallow some water, okay, you can go ahead. I'm going to be checking and feeling for her thyroid gland, and it moves up and down, and you want to check all parts, the isthmus and the other parts of the thyroid gland. I'll also inspect the neck from the front, and I want to look, and she has a really nice neck. You can tell that her trachea is midline here. This is a good time also to palpate the lymph nodes and make sure that they're not painful, tender, enlarged, or swollen, which can indicate signs of infection or another disease process. Okay. For further palpation of the lymph nodes, that would include the submandibular group, the submental at this time, the pre and post auricular, the occipital lymph nodes, the anterior and posterior cervical triangles, and the supraclavicular lymph nodes. As I move on down with the assessment we'll do other lymph node groups as we get to that area. Okay, and that we'll move on now to the assessment of the thorax and the lungs. I'll begin by standing behind my patient and just do a general inspection. And again, ideally this would be unclothed, but I want to look at her posterior thorax, and I want to look especially for any signs of any distress or work in breathing, particularly the intercostal retractions I'm looking for. I'll begin to palpate the thorax for any bony prominences and note those as well. Okay, and while I am in this position, it's a good time to check for fremitus. And with my hands on a different patient, different positions on her back, I'm going to ask Jordan to repeat after me: 99,
99, 99, 99.
Okay, then I'm going to check lung expansion too. If you'll just lean slightly forward for me, Jordan. Okay, and now deep breath in and out. Okay, very good. Okay, I'll also do percussion of the back, which is percussion of the thorax and lungs, and I do that in about 8 different areas along the sides of the spine and going down the rib cage, and I'm assessing for tympanic sounds, resonant sounds, any hyperresonant sounds, dullness. The normal finding would be the resonant sounds. The others are abnormal. Flat can indicate pleural effusions. Tympanic can indicate pneumothorax, and also can indicate some early emphysema. Okay. From this point, I'm going to start and do some auscultation of the lungs. And I'll listen at different points in a ladder fashion. And I'll ask Jordan to take deep breaths in and out while I do this. And I'm listening for any adventitious breath sounds such as crackles, wheezes, or bronchi that can indicate fluid or congestion. I'll listen with my diaphragm first. Deep breath. Deep breath. Okay. Okay. Deep breath. Good. Deep breath. Okay. And that's with my diaphragm, but we would also listen with the bell of the stethoscope as well. And now I want to walk to the front and inspect and assess Jordan's thorax and lungs, the chest from the anterior. And again, I would be assessing this on an unclothed patient, but I would assess the anterior for the same thing, any signs of any work in breathing, substernal retractions and intercostal retractions. I'd also be inspecting the skin at this point too. And we'll go ahead and just check for fremitus and just do 99.
99, 99, 99.
Okay. All right, and I don't feel any abnormalities from that. And we will listen also for breath sounds on the anterior chest as well. Okay, just deep breath for me. Okay, good. Well, also we will begin to assess the cardiovascular system at this point too, since we're in the thorax area. I will inspect first of all for any signs of any visible pulsations around the chest area. Of course, visible pulsations would be abnormal. I'm also going to be, as part of this assessment, assessing skin color. So, and I want to check also in the extremities. I'm going to do the cardiovascular system and the peripheral vascular system together. And I want to check and see if the skin is warm. And also an important part too is assessing the nails, the fingernails as well as the toenails, okay? And at this time too, I would inspect the skin around the nail and also the shape, size, contour of the nail. I'll blanch the nail bed here and judge a time for capillary refill. Normal is less than 3 seconds. An important feature to note too about the shape of the fingernail is note if there's any clubbing of the nail, which is an abnormal sign and can mean signs of not good oxygenation. We did check Jordan's O2 saturation prior to the examination as a part of the vital signs checked, and it was normal at 98%. Okay. Let's see, we want to do further auscultation too of Jordan's heart sounds, and we're going to start over here in this area, and we're listening. Okay, you could just breathe normally. This is for aortic, pulmonic. We listen at Erb's point, then down below, mitral area, tricuspid. And if you'll just hold your left arm up, Jordan, okay? And around here is where we get our apical pulse and also the PMI, the point of maximum impulse. This is a good time also as part of the peripheral vascular system that we will check Jordan's peripheral pulses. And we'll begin, and just looking straight ahead, Jordan. We would do this on each side, but we would check the temporal pulse here, and then we would check the carotid pulse, and as we palpate this, we would make sure to do the carotid pulses one side at a time so that we don't inhibit her circulation. Okay, we'll check the brachial pulse here. We'll also palpate the epitrochlear lymph nodes. We'll check her radial pulse here. And then we will check her femoral pulse and inguinal lymph nodes in her groin. We will do that while she's lying down as part of the abdominal assessment. We'll check her popliteal pulse, and then down in her foot, we'll do the posterior tibial and the dorsalis pedis. And those would be graded, and we're looking for a, they would be graded 0 to 2+. We're looking for a 2+ normal finding. Okay. And another thing that we will assess as part of the cardiovascular system is we'll be looking at Jordan's jugular vein pressure, and that will be best done in a lying position with the head of the bed elevated about 30 degrees. Okay. All right, so Jordan, I will ask you to go ahead, and if you will, I'm going to ask you to lie down for me. And we'll begin the examination of her abdomen at this point. We will keep Jordan closed for this examination, but ideally in the clinic setting, we would be assessing against the bare skin. And I do need one tool that we're going to check an abdominal reflex with. You do the assessment of the abdomen in a little bit different order than you assess other systems. You don't want to begin by palpating the abdomen before you auscultate, because you can stir some things up and not get a true reading of your bowel sounds. So I want to start with just inspection of the abdomen first for the skin to see if there's any to see the shape, the size of the abdomen, if there's normal contour to it. I'll listen to bowel sounds in all 4 quadrants before I begin palpation. Okay, and she has good normal bowel sounds, a nice flat abdomen. After I've listened for my bowel sounds, I can then begin to palpate Jordan's abdomen. And one more thing that I do want to listen to is also in the epigastric area for aortic sounds. and I can hear the pulsations in her aorta at that time. Okay, and then I'll just begin to palpate here. Okay, over in the right upper quadrant, I'm looking for feeling for any splenic enlargements. Over in this side, I'm palpating for the liver, and I do this both shallowly, then I go back and do deep palpation. I also want to check too Jordan's femoral pulses here and assess inguinal lymph nodes at that point. Okay, alrighty, I've got 5 minutes left. Okay, and now Jordan, we're going to do too assessment of your musculoskeletal system. Oh, one more thing I did leave out, it's just I want to check for inguinal retraction and just gently draw lines, and I'm looking for the umbilicus to retract as I draw those lines. Okay, let's do an assessment, Jordan, of your musculoskeletal system. So I'll ask you to sit up. Oops, I'm sorry, there was a couple of things I need to do while you lying down. So if you lie back down. Okay, you want to bend your legs towards your chest. Okay, all the way up. Okay, and then you want to rotate your legs that way. And we're looking here, okay, now back towards me. And we're looking at this point too for rotation of the hips. We check the knees. You put your feet down. A neuro check I'm going to do in this position. If you hold out feet, it's just use the other side of my reflex hammer. She's ticklish. And I just rub that on the outside of her foot. That's the Babinski reflex, and I'm checking to see if her toes fan out, which is an abnormal neurological sign. Okay. Now, Jordan, we can have you sit on the side of the bed. Okay. And then you can stand up. Okay. Let's look at your neck, and let's side to side, forward, back, around in a circle. Okay. Now, I want you to shrug your shoulders, hold your arms out. Very good. Okay, now I want you to do some flats, like a penguin, looking at our shoulder joints. Okay, now round in front. Okay, you bend your elbows in and out. Okay, very good. Okay, now with your wrist. Okay, around, and your fingers, move those, and down at your sides. Okay, now let's see. I also want to feel in Jordan's joints for any crepitus, which is an abnormal sign. And I'll ask you to take a few steps this way. Okay, now back towards me, heel toe, and then do a few tiptoe movements for me. Okay, kick your legs out. Okay, put your arms out and hold one foot up. This is a Romberg test. Okay, and then down. Okay, we'll also check Jordan's reflexes in her elbow, and also we would check that in her knee with her sitting. Okay, and sit back down for me. I've got just a couple of more things I want to run back through with the cranial nerves. We checked the optic nerve when we were examining the eye. We checked the trigeminal nerves. Jordan, I will ask you raise your eyebrows and lower them. Okay, tongue out to the side, back the other way. Okay. I'm going to touch, with your eyes closed, I'm going to touch your face with different objects. You tell me if it's soft or sharp.
Soft. Soft. Sharp. Sharp. Soft.
Okay.
Sharp.
And puff out your cheeks for me. And now let them in. Okay. And I've got a couple of objects I want to put in your hands, and you tell me what they are without looking at them. Okay.
A key.
Okay. And this one.
Safety pin.
Okay. All right, and we've checked the acoustic nerve through our hearing test and checked the other optic nerves as part of, the other cranial nerves as part of my assessment. And I will include a set of additions and corrections to this video. Thank you.